Welcome at this presentation. My name is Caspar Janssen and I want to share with you some recent developments in health monitoring at home that I'm working on. Home monitoring recently made a step forward with the introduction of the box, which is a collection of medical devices used by patients at home. It enables more frequent health updates and reduces at the same time the required visits to the hospital. In some cases, however, even more frequent monitoring may be needed. For example, to detect variations in heart rate, blood pressure or gait patterns during daily activities. And in those cases, for example, we can use a shirt, underwear or socks with integrated sensors. And these sensors then must be stretchy, soft and comfortable, of course, and easy to use and fully washable. In my research, I mainly focus on the development of those sensors. They must be soft and preferably textile-based. The question is how to make them. In the following slides, I give a few examples of how sensors can be designed using conductive yarns and fabrics. A simple strain sensor, for example, can be made by combining two conductive textile surfaces which change capacity when stretched. The fitness shirt, shown here, warns the users when his back is not straight during weightlifting. Another example, another simple way to make a sensor is by embroidering a conductive yarn in zigzag stitch. When stretched, there is less contact and the resistance increases. In the example, we show a disposable kinesio tape-based sensor patch which can be used for coaching and feedback during physio training. It stays attached to the body for about 3 days, even during showering. With the programmable knitting machine, it is possible to have full control over the stitch structure of conductive yarns. In a recent study, we showed that in that way, reliable textile stretch sensors can be constructed. And these can be used for movement and posture monitoring, respiration monitoring, and, for example, for a virtual reality shirt. Pressure can be measured with sensor consisting of embroidered yarns and a conductive open fabric. In this study, a bike saddle cover was designed which could measure seating comfort during cycling. The same principle could be used, for example, to monitor seat pressure in a wheelchair or decubitus. As a last example, I show the sensor tights that we developed for the Dutch national football team in order to monitor forces and impact on the lower limb system in order to prevent injuries. In this case, we used small coin-size accelerometer sensors, and these sensor tights are currently being prepared for production, and we intend to use them later on also for home monitoring of patients with Parkinson or rheumatism. To sum up, for applications in home care, reliability and washability is important and sensors should be soft, breathable and stretchable. Examples are shown of different types of textile-based sensors. What is not shown, but is also possible, are, for example, textile electrodes or sensors to measure humidity and temperature. We need collaboration with clinicians to validate the sensors for clinical use. Thank you for your attention.